My name's Jenny, and I'm a health visitor who works with preschool children and their families in the Gloucestershire area. Today I'm going to be sharing a presentation that looks at how your child may show how they're feeling in their behaviour when starting school. You might notice that your child may be sharing how they're feeling indirectly, using actions and not words. You might find that your child is attention-seeking, showing some fussiness, getting overexcited. They could be biting, hitting, having tantrums or spitting, not sharing, or showing some regression in their sleeping, eating, toileting or play. They may say something like, "I'd rather be small." It's important to look at why they may be displaying these behaviours. Could it be that they're hungry or tired, fearful, overexcited, frustrated, anxious, scared or confused? There may be other factors. Could it be that your child is picking up on your emotions as a parent if you're anxious about them starting school? They may be aware that life is changing and that's a lot for them to cope with. They could be faced with too many choices. They may not be feeling heard or validated, and they may be unable to use the words to say how they feel. And as a parent, what are you feeling? There are lots of factors which influence the relationship we have with our children as parents. It could be that we look at our own learned experiences from when we were children. Or are our expectations of ourselves as parents too high? Are there some difficulties at home? Difficulties with employment, illness, finances, paternal mental health, maternal mental health, substance misuse, or domestic abuse? Or are there family myths that impact the way in which you parent? Could the number of siblings in the household impact on you? And of course, something we've all experienced in the last few years, COVID-19 and the impact of lockdown and isolation. So how can you help? It's important to provide consistent boundaries. Stay calm and avoid saying things to hurt them back. Don't hit, bite or kick back or overreact. If you can, count to 10 unless it's dangerous to wait. Always be prepared and be a positive role model for your child. Don't ask them for more than they can manage. Validate their feelings. Ignore negative behaviour as much as possible and praise positive behaviour. Take the time to play with your child. Use distraction if needed. Introduce a reward chart. Choose your battles. And try and follow the do, not don't rule. So, for example, do walk along the road with me holding my hand, rather than don't run off. There are lots of useful links on this presentation, which takes you to further information about managing your child's behaviour. And of course, as a health visiting service, we're here for you if you need us. And details of your local health visiting team will be on the website. Thank you.